My guest is Daniel Benning, a functional medicine consultant for Biotics Research, but also a CCN and good friend. We've been going to national nutritional conferences for over 20 years. Viewers may remember a video about Daniel's dog, a Labrador with parvo, who was cured using nutritional supplements Daniel put together. Poor Duke had bloody diarrhea and the vet said he wouldn't make it. The bloody diarrhea stopped and he had solid stools in 3 days. You can see a Tuesday Minute link on this page. Here's Daniel talking about repairing the colon in another way. Well, Daniel, it's always good to have you come and share some clinical stories and some insights that you have on different products. And butyrate is one of my favorites. You know, butyric acid, 4-carbon chain, comes from butter and other things. Your colon make it from fiber, and it's a great product. So I wonder if you could just give us some of your perspectives of how you use it and the feedback you've gotten from your clients.
Yeah, Joe, thanks for having me again. I always appreciate the opportunity. You know, I've been kind of known as the butyrate guy for about 30 years from being in the field and having great experiences with the doctors out there. But sometimes butyrate isn't really the first thought of product with typical GI cases. But let's start out in the beginning with butyrate. It's your primary fuel for your colonocytes, as you see in the first slide here. This is tributrin. So most of you are familiar with sodium butyrate, maybe, which is 1 molecule of sodium to 1 butyrate molecule. Ours is 3 butyrate molecules to a glycerol carrier. So you're getting a lot more butyrate per capsule. But again, the primary fuel for your colonocytes makes a healthy cell. And as Joe had mentioned, what makes butyrate? Fiber and good probiotics. So a healthy colon and healthy GI helps make butyrate levels, primary short chain fatty acid. But what we're now seeing in the literature, big in the, in our doctor world, is it helps activate at the GI level our own GLP-1 for weight management. So this has kind of been my new secret sauce to helping these patients who are doing GLP-1 therapy for weight management. But there's so much to butyrate, Joe, as we've talked about over the years. We could talk about this for a couple hours, but I wanted to share some of the real big key components to utilizing butyrate in your more difficult GI cases. Sodium butyrate production in the next slide, a focus on butyrate, colon cancer, obesity, and insulin resistance. Well, we talked about obesity with GLP-1 production, but if you look at PubMed, the studies on neoplastic activity in the colon is pretty effective. So you look at butyrate for colon cancer, Crohn's, and colitis. Very, very effective. That's right in the medical literature. As you see here in the slide, it influences systemic metabolic and immune function, as well as reducing intestinal permeability and inflammation. Butyrate is an NF-kappa B inhibitor, an anti-inflammatory in the colon. So it has a high bioavailable form of butyrate, the tributrin, 3 molecules again. So a superior half-life versus the sodium butyrate. So you need less of this product, only 1 or 2 capsules a day. In this slide, you'll see tributrin protects the liver and intestinal barrier from a variety of insults, including ethanol and bacterial toxins. This is a kind of, I call it one of the missing nutrients in really good GI health protocols. In preclinical studies, the butyrogen, the tributrin, generates butyrate and other short chain fatty acids. So this product is not only butyrate, but it's a butyrate generator, and significantly lowers gas production when compared to other prebiotics.
That was a big factor with the old sodium butyrate, because Biotics was the first company to really come out with a butyric acid, like you said, 25, 30 years ago. But boy, you'd open that cap, and oh boy, it was very odoriferous.
Very odoriferous. And you needed 4 to 6 capsules a day.
Yes.
And now the non-odoriferous butyrate we have at 1 or 2 capsules a day for a therapeutic dose.
It's huge. That's a big difference.
Yeah. So again, this form overcomes the limitations imposed by the short half-life of butyrate. It prevents fat accumulation and liver injury following alcohol toxicity. There's so many avenues to go with this product. It excites me. I love talking about this product, if you can't tell. But again, as you see in the slide, it downregulates NF-kappa B. So that's a critical regulator for inflammation. I use this product for difficult constipation cases because what are we doing? We're taking inflammation out of the colon.
You know,
it's
it's
also
interesting.
protection from toxins such as C. difficile. One of my mentors years ago showed how it's very effective at breaking down biofilms and getting rid of candida. So the list is long when it comes to utilizing Butyric-Cal-Mag for your patients.
You know, I just have a personal friend that had severe bleeding in his stool, and he was really concerned because he was seeing all this blood in the toilet. He says, "What would you do?" And I said, "Well, first thing I would do is I would take some butyric acid." And I said, "I'll tell you what, let me just give you a bottle, try it." And so I told him to take 2. I know the dose is 1 twice a day. I told him to take 2 twice a day. I mean, when you see blood in your stool, to me, that's a big warning sign. So I wanted to dose them up pretty good. So we took 2 twice a day. He comes back to me 2 weeks later and he said, "It stopped. The bleeding stopped." And then he took another bottle, and then he obviously what always happens with patients is they stop taking the product and the bleeding came back. He said, "Well, I better go see a GI guy," and ended up spending $500 to see a GI guy because he didn't have insurance for 5 minutes, and he told him to take a steroid, which he took, and he felt sick. So he went back on the butyrate, and lo and behold, 2 days later, he was fine. And so it's not a miracle worker like it's going to heal everything just like that. I mean, it takes time to make tissue changes, but boy, it's giving, like you said, it's giving the colonocytes the energy to repair.
Right.
So.
Yeah, love this product. So many ways to utilize it. And again, fiber and probiotics make it, but we took that out of the diet with antibiotics and McDonald's. And so definitely an effective nutrient for sure.
Now you also had, and this is one of your favorite clients is the cardiologist, and he uses it for a different reason. Why don't you jump in with that?
Yeah, so he presented a study to me years ago that because it's an NF-kappa B inhibitor, an anti-inflammatory, it does go systemic. You absorb it very well. And he showed it was helping reduce plaque formation in his cardiovascular patients. So he uses a lot of this product in his cardiovascular patients as well.
So I love a product that does multiple things on multiple levels. You know, you get the side effect, the positive side effects, as opposed to the drug commercials where you see all the negative side effects.
Absolutely. Absolutely.
Well, Daniel, thanks for taking time. It's always a pleasure. Talk to you soon.
Great to talk with you, Joe.
Bye-bye.
Butyric-Cal-Mag is one of those products to remember because, among other things, it reduces colonic as well as systemic inflammation via NF-kappa B reduction. Butyric acid gives colonocytes the energy to heal, thereby supporting both diarrhea and constipation therapies. Thanks for taking time to be with me today, and I look forward to being with you again next Tuesday.